We're going to talk briefly about pin care. Looked at skill 918. We're going to talk about the difference between skin and skeletal. Skin, I just showed you, this is skeletal. Visualize a human foot on the end of this pipe. This is bolts put through a person's leg. They would run through the leg, and you might see bolts on the end or bolts here with the rope going through the bolts, going down to a weight. So the bolts would have string, a rope going down through here to a weight that's freely hanging. Okay? So this would be skeletal traction. If you have a chance to see it in the hospital, take a look at a patient. Ask permission, take a look at their pulleys. The rope will be through here. The main things you need to know is you still assess the 7 Ps, you still assess the neurovascular, assess the Holman sign. Have somebody help hold the leg while you assess and flex their foot. You also need to perform, after the 7 Ps, you need to do a skin assessment. If they have, I'm going to lay it down here, my videotape lady. I'm going to lay it down so you can see sideways. If they do have bolts on, in through their legs, you need to put on exam gloves. Don't bare hand these. Put on exam gloves. Check your doctor's orders for how to clean these. You need to look for certain things. You need to look for bowing of the boat. So if this boat was bowed, like bowed, tenting. What if the skin was growing up on the boat like this? This is tenting. The skin's growing up the boat. Think of a tent. Tenting. Need to look for redness, drainage, and pus. You may want to do a culture if you see that, but check your orders. Need to assess them for, I said tenting, I said drainage, temperature. With your glove on, you can feel around the boats. Is their skin warm compared to the other leg, that's unaffected leg? So check for warmth, redness, temperature, bowing or bending of the pins, and tenting, where the skin grows up the boat. There is one doctor, Dr. Zeke and Zeta, they like to have you to buff their pins. I'm going to show you. This is not a sterile procedure, it's a clean procedure. Put on your exam gloves, get you a gauze. Okay. And I'm going to show you how to buff your pins. You can describe this to your person checking you off. But you're going to open your gauze up and not touch the inside of it. You're going to actually take this and buff your pin like this to get the skin down. So I'm buffing the pin down close to the end of the insertion. Get you another gauze and do the other side. But buff down the pin to get the skin off of the bolt. That's buffing. The other thing I have you do is to clean this pin. Clean the pin. You want to make sure that you do pin care. The pin care would be using sterile technique. There's your betadine swabs. If the doctor says betadine, if he says half and half peroxide and betadine, you'd have a bottle of solution. But I'm going to use betadine. So check your doctor's orders. Open this up, and if you don't touch the ends of your swabs, they are sterile. You would take your swab one at a time and go around, circular action, around your pin. Okay? And you'd get rid of it. Get you another swab and go around the pin again, circular action. Okay? And you do each pin this way, and you'd go up the pin as you went. Go close to the skin and then go up. And then it would tell you to clean the pins. It says start at the insertion site and working outward. That means out. If you have a lot of these bolts or pins, go outward, further out, target area, and up the bolt. Make sure you get all the drainage off of there. So sterile technique. Use sterile gloves if you have them available, or you can use clean procedure. Check with your hospital policy. Place application in the solution, or use these betadine swabs. Clean outward. Use each applicator once. Use a new applicator for each pin site. So don't use a swab here, here, and here. Use one or two. Use 3 or more here, 3 or more there, 3 or more there. And again, you may have to have a whole bunch of those. And then you still want to tell them to turn, cough, deep breathe every 2 hours and do your 7 Ps on both legs, the one with the bolts in, the skeletal traction, and the one without. Thank you.